Hello everyone, and welcome to our special World Kidney Day Kidney Conversations event. I'm now going to hand over to Sandra to kick off the proceedings.
Hello everyone, welcome and thank you so much for joining Kidney Conversations on World Kidney Day. A very special day for the whole kidney community across the globe, and it's really great to see such a range of people joining us today, representing all parts of kidney research and in fact the whole kidney community across the UK. It's been fantastic to see some of the coverage that's been happening today, conversations and noise that we've been making about increasing awareness and the importance of kidney disease. And I expect many of you that are joining us now have been part of doing that. If you do use Instagram and Twitter, please have a look at our feeds that we've been running today. And if you can, share some of the statistics and kidney disease information we're putting out there to help us reach more people and increase the understanding of just how important kidneys are. We'd really love it if you can help us share some of those posts and reach your audience and expand the audience that we can get to as a group. We're asking everyone to, before I introduce myself, I just want to run through some quick housekeeping for the event. The session is being recorded, you might be able to see that, and we want to be able to do that so that we can share it with people that couldn't join us today. We have lots of people that were very keen to be with us and couldn't make the time, so they will be able to watch it later at their leisure. But we are asking everyone, if you can, to stay on mute, just because otherwise we get some distraction noises. But if you are comfortable, please do leave your camera on. It's really nice for the presenters to be able to see you listening to what they're saying. So feel free to keep your cameras on, but microphones off if possible. I'd also like to thank everyone who's submitted questions in advance. We've got quite a packed, tight hour today, but we would like to encourage you to submit questions when we get to the stage with Joe Chilcot. Dr. Joe's going to be talking to us a little bit later, and if you want to do that, you can put those questions in the chat. We'll try to answer as many as we can. So my name is Sandra. I'm the Chief Executive of Kidney Research, and I've been with the charity since September 2012. I'm really proud to have been part of the growth and development of the charity for nearly 10 years now. And in that time, we've seen a significant increase in the research spend that we make, but also in achieving greater collaborative working across the whole of the community. On both of those counts, while we're really proud of what we've been able to do, there is still so much more to do, and I hope you'll be able to play your part in helping us do even more in the years to come. I'm a really keen advocate for reducing both inequality and inequity, particularly in health and social care settings. And our drive here, of course, at the charity is to improve the prospects for every single kidney patient. As you all know, World Kidney Day is a global campaign aiming to raise awareness and the importance of kidneys and reduce the frequency and impact of kidney disease, which many of you will know only too well. It's a really important day for kidney charities, including us at Kidney Research UK, as it gives us a chance to reach new people, raise more awareness of kidney health and kidney disease, and it's an opportunity to really unite and empower the whole community. I'm very excited today that we're being joined by one of our ambassadors, and I think Andrew has been able to, we have just been on a session with him. I'm just hoping he's in with us now. He is, before I run into the introduction. So delighted to welcome Andrew Cohen. Many of you will know, of course, Andrew's a former professional footballer. He's going to be telling us of his story of living with kidney disease and the impact for him on his mental health. We'll then hear from Joe Chilcot, a reader in health psychology, head of the health psychology section at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. It's great to have you with us, Joe. And he and his team are investigating the most effective way to assess mental health and develop treatment pathways for kidney patients. And at the charity, we've been delighted in the past to have been able to fund some of his work, which we're also doing currently. And then we'll hear from Bushra Riaz, one of our colleagues, policy officer at the charity, currently involved in our work to lobby government and understand and improve mental health support, which is available to kidney patients, and ultimately to increase and improve that support. But our first speaker today, I'm delighted, really delighted to be introducing you to, is Andrew Cohen. Andrew is best known for his football career, much of which was at Manchester United and at Newcastle United. And of course, he was also an international player for England for many years. And if you're not a football fan, he is a fantastic goal scoring machine and has a huge record, which people strive to try and take away from him. He retired in 2008. And sadly, after that, in 2015, caught a virus on a work trip, which led to him developing a rare condition that damaged his kidneys and caused his kidneys to fail. Andrew then had to go through a life-saving but grueling time on dialysis until he received a kidney transplant 2 years later in 2017. Since I first met Andrew, it was clear to me that he's passionate about helping others cope with the challenges that he faced with kidney disease and transplant. And in 2020, I was delighted when he agreed to set up the Andy Cole Fund with Kidney Research UK to raise awareness, to improve the support for mental health and well-being for kidney patients, as well as funding pioneering research into improving kidney transplants. So Andrew, huge thanks for joining us today. People I know are very keen to hear directly from you, and many of them will have joined us to hear firsthand from you. So if I can take us back to the beginning of your story. You retired from football and were embracing a new chapter of your life. I'm sure lots of football activities still involved in that. But when did you first start to notice something was maybe going wrong with your health?
Well, I wouldn't say I noticed it, because I mean I kind of like ignored it. I was on a trip back from Vietnam with Manchester United, and I remember before I left the hotel, I remember just going to the toilet to have a pee and having a pee, and I just thought I was dehydrated. I thought, oh, nothing of it. Just drink loads of water on the way home, and you'll be okay. So got on the flight, returned back to England, and what I noticed once I got back, I just felt really tired, but then I just put it down to jet lag, and then I started to gain a lot of water retention, and that's what I found really strange. But me being me, I still refused to go to the hospital. I remember calling my old doctor who used to work for Manchester United, so he came round to my house and he just ran a few tests on me and said to me, look, what we're going to do, I'm going to get you into the private hospital to have a few tests, and we can find out from there what the situation is. But you never know, it could be nothing, or it could be something. So I just thought, oh, it's going to be nothing, just get on with it, man up, get on with it.
Man up. And, yeah. And it obviously was something, and it wasn't just something you could man up against. It's you know, and many other people on the call will understand that. I mean, you were at that time, and you are now, I think, returning to, you were physically very fit before. How did it feel to suddenly have that impact of a change and having kidney disease?
I think that for me personally has been the toughest thing. I think to be fit virtually all your life and then go on to become an elite sportsman, and then I found myself in a position of, like, you know, when I got told by the specialist that I've got a problem with my kidney and there's certain things you won't be able to do anymore. I think he was more interested in, I remember him saying, look, you won't be able to do what you want to do, but pottering around the garden is going to be good for you. And I kind of like said, I can't pot around the garden. You know, I've been an elite sportsman for over 20 years. You know, I've always been fit. So for someone to turn and say, well, you can walk around the garden and do a little bit of this, I couldn't do it. I couldn't get my head around it. I remember, like, when he said that to me, I still continue to go to the gym. I still continue to do what I want to do. And I remember, like it was yesterday, every time I went to the gym, all I ended up doing was coming home and falling asleep for virtually the rest of the day. So I was just so tired. I was so tired and still trying to understand it. I think going through all the protocol as well was difficult, you know, because they talk about they can possibly save the kidney and things like that, and you actually buy into it. I remember I actually brought into it and thinking, right, here, if I take all the medication, you know, there's a good chance that I won't need to have a transplant. I didn't really understand what a transplant was and how grueling it was going to be. So, like I said, you grow into it, and mentality is right. If you do these things, you know, you've got a good chance of bringing the kidney back, which ultimately that was never going to be the case.
So that, I mean, you're describing a really tough time in a few short sentences there, but kidney disease is often called an invisible illness. And how did it feel when people, or how does it feel when people assume that you're fine because on the outside you look okay, you know? And is that an added difficulty that people don't understand, perhaps?
Yeah, for me personally, it is, because I think when people know you've been unwell, and actually people actually find out what it is, I think a lot of people become ignorant towards it, because they look on the outside, so, oh, you look really well. Oh my God, I thought you was ill, or you're doing really well, and whatever. But they don't understand the turmoil, what's going on inside, how you deal with things, how you deal with the medication, because medication has a different reaction than others. You know, I think for me personally, when it comes to medication, I think I had every side effect possible, which was hard work. And then changing that over and just trying to understand what I was going through. You know, I still try to get my head around it now, but I'll be brutally honest with you. My personal trainer, a guy named Wayne Andrews, he's got exactly the same thing. And the way he deals with it, I'm learning off him. I mean, I learn off him now. You know, the way he deals with it, what he tells me you can and can't do. And he's been brilliant. So I've been working with him over the last year. And mentally, he's definitely put me in a different place as well.
That's good. It sounds like you've found someone who's the right match for you then. You say approaching it from a different angle, but you can learn. I'm sure he's learning from you too.
Yeah, because like I said, there's a lot of people who don't want to understand him because they're ignorant to it. You know, and that gets you frustrated, and that upsets you when people don't want to understand it. I think I mentioned to you before when we had the games up in Newcastle, and speaking to a lot of the guys who were still playing football, and you know, when they was turning around and saying, "Look, you can do it. You know, we can do it. Look at us," and whatever. That really brought a tear to my eye.
That was the transplant games that was early days for you, I think, Andrew, wasn't it, when you went to the transplant games in Newcastle?
Yeah, excuse me. Yeah.
I was going to ask you, maybe this is if you're okay to continue, an appropriate time to do it, but you've spoken to me before about the psychological impact, and you've spoken in public before about the real burden of the kind of aspects of mental health around coping and living with kidney disease. And I think
mentally, yeah, it's the toughest thing that I've had to deal with. You know, because a lot of things you can literally palm off. So I just get on with it or whatever. And I've been used to, like, obviously being a professional footballer, you palm a lot of things off and you get your head around it. But this is like it's an invisible disease that you have to deal with every day. And there's some days that work, there's some days that don't work. You know, so you got to try and gauge each day as it comes. And like I said, I think what I've realised that if you're around people who don't understand it, you know, it's tough. Really, really tough, because mentally they take a lot out of you because their trust in you is not a lot. And all you want is a little bit of help from them. And people who are not prepared to help you, that they draw your energy. You haven't got a lot of energy when you have this disease. That's what I've realised as well. When you have this disease, you don't have a lot of energy. you need a lot of positive people around you.
I think your openness, and you've had conversations on various sport programs talking about it, and in television and radio interviews and newspaper interviews. Your openness about the challenges and how hard that's been is really valuable for other people to hear. So I think thanks for being so honest and open about that today, but in other times too, because I know from other people living with kidney disease, they really appreciate you putting this on the agenda and, you know, trying to encourage other people to see behind the, you know, what's immediately in front of them, that it is a really tough disease to deal with. And it's fantastic to have you speak about it in the way that you do, because it helps us reach other folk, and I think it will ultimately help us get more.
It does get easier.
Yeah.
It does get easier, but ultimately you still feel the same pain. You know, you're still trying to understand, you know, why you find yourself in certain positions, or why some days you can't get out of bed, and you know, so you do question yourself. I'm no different than anybody else, but all I do every day is, you know, try to be better than I was yesterday. And like I said, some days are good, some days are bad, but you just got to try and work with it.
That's quite a powerful statement to make. The pandemic must have added to that pressure and difficulty, I guess. The last 2 years will have brought new challenges and additional pressures.
Yeah, it did. I think that the first lockdown was the toughest one, because you didn't know what to expect. So I think for me that was the toughest one, because like I said, I live by myself, and you know, in the end, my daughter come around for a week because she was shielding as well at the time, so I could spend time with her. But it gave me a lot of time to sit down and you reminisce or think about things and whatever it may be. And that for me was a good time, you know, just to sit down and evaluate life and find out where you're at. So in the end, I kind of like got my head around it. The second one was tedious. The second one was really, really tedious. I was calling up the walls the second one. You know, it was driving me absolutely berserk in the end. And then, you know, I basically stayed away from it for 2 years, and then I caught COVID in the end, and I landed myself in hospital for 8 days on oxygen. And I was worried that I wasn't actually going to make it through. So, you know, when I do look back and say, look, you've had a kidney transplant, you've ended up with COVID, that knocked you backwards as well. You know, that played about your kidney for a minute. You know, all I say now, you just got to take it for what it is. Live each day as it comes. You've got to enjoy it. You've got to enjoy life. Your second chance. You've got to go for it.
Andrew, thank you for what you're saying. I don't know if you can see, there's lots of comments coming in the chat. We'll send them across to you later if you can't see, just people thanking you and for being so open and authentic about what you're saying, and repeating what I'm saying. This is really important for people to be able to hear you saying it. So huge thanks for doing this. Is there any advice you would give to anyone, perhaps this is an unfair question, about whose mental health is suffering because of kidney disease? Talk about
it. Yeah, you have to. Like I said, I'm lucky now, because like I said, my PT, you know, now we have a chat virtually every single day when we're in the gym. We're supposed to be working out, but we're not talking majority of the time. You know, I think that's a massive release for me. It's a massive release for him as well. You know, and like I said, you have to have positive energy around you. I think since I've moved back to London, I've had a lot of good people around me. Obviously, you know, I got divorced and that, and you know, I mean, my ex-partner couldn't get her head around it, didn't want to understand it in the end. I mean, it's like, you're always in a mood, or you know, you're always tired, or you're always sleeping, or whatever. And when people say that to you, that, like I said before, and that takes away your energy, you know, because all you're trying to do is get to tomorrow, try to feel a bit better tomorrow, you know. But like I said, since having so many people with positive minds and good energy around me, I think things are starting to change, definitely.
That's good to hear. Andy, I was delighted when I've called you Andy because I'm thinking of the Andy Cole Fund, but I know we you want to be Andrew now, and that's how I know you normally. But you agreed to launch the Andy Cole Fund in May 2020. We did it in lockdown right at the beginning. So it wasn't quite what we expected. We thought we'd head up to Old Trafford and do something, and we were actually all online, weren't we? But that was a fantastic step forward for kidney research, and we're so honoured to have you support us in this way. The fund is going to be used to put towards research into transplants and improving the prospects for anyone else facing a transplant like you've just described, but also to ensure we're funding research that helps mental health and well-being for patients. They're both really key areas that need attention. Your fund will be used to support some of Joe Chilcot's research and the type of work that he's going to tell us about shortly, and we'll hear more about that later. Can I ask you, we're just coming to the end of our questions now, what you want to see happen in the next few years from research? Is there something you're thinking, that's what I want the charity to be? That's something I need to get from this?
Yeah, I think with anything in life, you've got to move forward. I do honestly believe with kidney, it needs to be spoken about more. It needs to be more in the forefront of people's minds. You know? If you ever see any adverts, it's always about heart and things like that. But the importance of your kidney is crazy. You know, and I think this is why I want to get involved, because I want to give this a real good push. You know, because there's so many people who have this disease or silent about it. People don't understand it because, like I said, they don't want to understand it because they think, oh, it's only a kidney. But little do they know how much your kidney does for you. You know, so I want to get behind it. I've had a lot of support, obviously, from Manchester United regarding this, and a lot of other people as well who would be more prepared to help me through this.
It's fantastic. And I think that's why we're so grateful that you're joining our team at the charity, because awareness raising, I know, is fundamental to us being able to do more, fund more, make a bigger difference. And you're really getting behind that with us and helping us do that. Before we set up the fund and before the pandemic, we went to Bristol together. That was probably quite early in our relationship as with you as an organisation. And you met some of the researchers there who were looking particularly at the type of kidney disease that you have. Do you want to say a few final words on what that felt like?
Yeah, that was special. That was really, really special. And I think for me to go there to understand it a little bit more, you know, all the hard work, what goes into it, but every individual who seems to have this illness goes through exactly the same thing at some stage. I mean, we all think, oh, we're by ourselves. Ultimately, we're not by ourselves, you know, but if you listen to all the stories, they're exactly the same story. And that's what I found really, really powerful. I think the work they put in, I've been fortunate, obviously, to go in the labs and look at things. And I still try to get my head around it now, what they actually do. You know, now they actually understand it. But it's an eye-opening experience for me. And it's something that I do cherish. You know, so when I do speak about this, obviously with my mates and whatever, you know, they know I'm very well informed about it now, and they know I understand what I'm going through.
Yeah, thank you for that. It's a very special day for a lot of the researchers too to have you. And I know you played at Bristol before, so we went to the children's ward after we went to the labs, didn't we, and met some of the local people, parents, and I don't think the little ones knew you because they were quite tiny, weren't they? Mums and dads that were there knew you from your Bristol days, and it was a very special day for them as well.
Very.
So thanks for coming down. So I'm just about to finish now, but I heard a rumour that you might be back at Old Trafford playing in the Legends match. Is that?
Yeah,
I'm tell me that. Back, is that right?
Yeah, I'm fully retired now. I think where my kidney is, based at the front of my stomach, I think I've been advised that it wouldn't be good to play, you know, because it's such a pronounced area. But I'm going back as assistant manager. So, and I always enjoy going back to Old Trafford because we always have a laugh and joke. So that's a big day for me. I think, you know, all the boys, all my ex-teammates know what I've been through. So, have them around as well, you know, it's always good fun.
So are you coaching the strikers then?
Well, I won't be coaching. I'll be too busy having a laugh and jokes. So I'll be looking forward to the day.
Good. And that's a game against Liverpool, isn't it? So
That's
I'm
right,
sure
yeah.
all of our audience, whoever their allegiance is, and whoever they support, they'll be backing you on the day, Andrew, I'm sure, because I think we feel that you're really part of our team now. So I'm sure you'll have their support, whoever they might normally cheer for on a Saturday.
Thank you.
If that match goes off. Andrew, there's not really much more I can say other than huge appreciation, not just for coming today and sharing your story with us, but for all the various ways you're engaging and supporting the work of the charity. As I said at the beginning, we've grown a lot, we're doing a lot, but there's so much more to do. And you know, we owe it to everybody who's faced a diagnosis like you have to do more, and we can, with your support, achieve that more quickly. So, and the chat bar is full of people making comments, so we'll get them all across to you. So
no problems. Thank you.
It is vital we continue to talk. I'm glad that was your response. You said, you know, we've got to talk.
Yeah,
about
don't
it.
quit.
So important.
No,
Got to talk about it.
Yeah,
got
that's
to raise
the easy
awareness.
way. Yeah. That's run through my mind many times. Quit.
Yeah.
Don't give up. Don't give up.
Fantastic.
Yeah,
so good to have you today. And I know that everyone else who's listening will be saying the same things. So I'm going to move on and introduce Dr. Joe Chilcot. Joe has met with Andrew in the past, and we've also been funding some of Joe's work. His project that he's currently working on is funded by Kidney Research, and Joe and his team are really working to better understand how adults with chronic kidney disease and depression are identified and treated, and to use that information to design more effective management pathways. And it really is in an effort to transform mental health treatments for kidney patients, which is an important part of the charity's strategy. So over to you, Joe. We will have a chance to ask some questions from you when you finish speaking, but you're going to give us a presentation first just to set the scene.
Great, thanks so much, Sandra. And just want to really echo what Sandra said in relation to Andrew's really inspiring words and how brave and open and honest about his experiences. I was watching some of you on your videos, and you could straight away see the connection and the shared experience. So Andrew, it was really powerful. So thanks so much for that. So I think, you know, thanks for the invitation today to talk about some of the work we're doing in relation to depression in people living with kidney disease. And it's really important to highlight that on World Kidney Day, because we talked about, you know, kidney disease in itself often being an unseen and under-recognized, you know, long-term condition. And that is also true for mental health. And the two together can have, you know, such a significant impact to people's lives. So, you know, we've been researching kind of the mental health and psychological aspects of kidney disease for quite a few years now. And our recent project is a national study to try and establish how do we actually identify depression in people living with kidney disease, and what do we do to treat it. And this has come about really because we've done various bits, as many other research groups have, different studies and trials. And what's quite remarkable is there's been a lot of research actually done to date, but very few of that pieces of work have actually translated into everyday clinical practice. So we wanted to understand really why that might be. So our study is looking at the identification of depression across the whole spectrum of people living with kidney disease. That's with progressive CKD, people on dialysis, and people with a kidney transplant. And this piece of work is kind of sectioned into three main activities. The first is to look into the literature, so all the published evidence that exists, any study that's looked at depression in people living with kidney disease, and we're looking back from about 2010. And the first thing to say is we found over 950 published studies that have looked at depression and or things like anxiety in people living with kidney disease. And the striking thing about that is the majority of these studies have been important because they've tried to understand why people might get depressed, what are the psychological, physical and social factors that might explain why some people get depressed and that kind of thing. But very few studies actually look at how we identify it, and also what do we do, what treatments are appropriate for people, what treatments are effective, and ultimately what treatments are safe. So we have very little evidence actually with regards to what treatments might be helpful for people. So that's part of the study to understand that. So just to give you some context, we know that depression is very common, with about 1 in 3 people living with kidney disease experiencing significant depressive symptoms. So these might include feeling down, low or hopeless for at least 2 weeks. It could be recurring thoughts of guilt or shame. They can also manifest as physical symptoms, such as feeling fatigued, sleep disruption, and those types of things. So we know depression is very, very common, and it's also associated with poor outcomes, particularly low quality of life, and sadly clinical outcomes and events. The depression itself is a predictor of poor health outcomes. But as I reflected earlier, we actually know quite little about how to effectively treat and support people manage their mental health. So there are guidelines, so national guidelines exist that offer some guidance as to how we might identify and manage depression in people living with a long-term condition. But these aren't specific to people living with kidney disease and all the particular nuances that kidney disease and the struggles of people living with kidney disease may face. So we don't know whether these guidelines are actually appropriate, and indeed whether they're used as part of clinical practice across renal services. So our aim is essentially to understand more about the identification of depression in this setting. So as I said, we've done a scoping review to see what the literature is telling us, and that's helping us inform the next phases of our work. We're currently doing a national survey of all UK renal services, so it's over 70 centres, and we're actually asking them some particular questions about their practice with regards to supporting their patients with depression. So we're asking things like, do you proactively screen your patients? So we can do that with questionnaires and other methods. And what happens if someone is identified as having depression? What's the referral mechanism? Who do they see? But critically, what's the provision? What's the resource available on the ground to support people? So do patients have access, for example, to a counsellor, psychologist, or where relevant, psychiatrists? And we do know from previous surveys that some renal centres have very little or indeed no psychosocial care. So there's nobody in-house to help support patients manage the psychological and social impact of their kidney disease. So we've got this survey, it's currently underway, and we're going to use that data to identify particular renal services that have some good practice already. That might mean they already have a psychological team, they might actually have proactive ways to try and support patients. And we're going to visit them to see how it works for them, to try and share that learning that we can share with other renal centres. And we're also going to go into renal services that have very low levels of provision or no support at all to work out what are the key barriers to offering these services. And we're going to take all this information together with a specialist working group to try and draft the first ever guidelines for people living with kidney disease around supporting their mental health. So we aim to develop this kind of clinical pathway, suggesting with evidence-informed practice how we identify depression, how often should we be looking for it and screening and monitoring the symptoms, and what treatments might we offer to different people depending on their needs, depending on what kind of support they want. And we hope that would really be, the first attempt to make sure that we're recognising mental health alongside the physical health in everyday practice of people living with kidney disease. And critical to this work, and I noticed some of our supporters actually on this call, is our PPI group. That stands for Patient and Public Involvement Group. We are very lucky to have a really dedicated team of expert patients who are really supporting us with refining our research, making sure it's relevant to you, to the kidney community, and they're giving us such wonderful feedback, and it's really appreciated. So that's all I've really got to say, Sandra, at the moment about our study. But happy to take some questions.
That's Brilliant. Thank you so much. I mean, you've talked in a very short few minutes about a huge piece of work that's of fundamental importance to improve the prospects for kidney patients or people living with kidney disease. I think it's really important, as you've just described, about acknowledging the scale, getting acknowledgement of the scale of the issue, and also the comprehensive approach to understanding who's doing what about this. And I think that, from my background's in mental health nursing a long time ago before I came here, and there has to be a comprehensive look at how are the services actually dealing with that, so that access for everyone becomes available. And the charity is really keen to do everything we can to get behind the research and the outcomes and pull together the community to push for change, which is why one of the reasons we wanted you to come today to talk about it. I was going to ask you about how you involved patients in the design of your study, and you've kind of beat me to it with your comments that patients have been involved, I think, from the beginning of how you designed the study. Would that be fair to say?
Yeah, absolutely. So we had some patients involved right at the beginning when we were just thinking about the ideas and actually applying to your grant round, in fact. So it's from the conceptualization of what's important, it's from the beginning. And then as, once we got the funding and the project started, we convened, quite a large group. And there's a network called KPIN, which is open, and researchers and other kind of projects that are happening in the renal community can ask for people living with kidney disease to get involved in such projects. And we had a really great response from the community, people offering their time and support for the project. And they meet as a group, as an independent group. They have a chair in it, and it runs and it advises us on the right path of the research to making sure if the individuals that we're trying to improve the lives of are at the center of everything we do in terms of how we run the study and how we communicate our findings back to the renal community.
I've got a question I can see in the chat bar, which is asking how open have renal units been about their services?
So at the moment, the survey is still live. So we've had about 45% of services have responded so far. And so far, yeah, people have been very open about their level of resource and their experiences. And we haven't got any firm data yet, but I think when we actually visit the centres, we're going to interview not just patients, but also all the staff members who are involved in kidney care to understand their experiences of accessing psychological support and what might be the barriers. And some of these barriers might be very local issues, but some of them might be broader. They might actually be more kind of structural in our health system and possibly relates to stigma around mental health and those types of issues. So we're really going to try and unearth some of the what we call the facilitators and the barriers to actually implementing better psychological care.
I like that phrase, unearthing the facilitators and barriers. I think there's some quotes to be coming out from some of the things Andrew said, and now you're saying, no, that's exactly the kind of thing we need to be doing. And again, the backing of the team at Kidney Research and all of our wealth of supporters that we have, I'm sure we'll be getting right behind you as that goes forward. Do you have any thoughts around whether the type of mental health support that should be offered? I know it's, you've not reached that stage of putting forward recommendations, but should that differ according to patients' age? Do you see age as being a factor in the offering?
That's a very good question. What we know is that there is a relationship between age and mental health. Typically, younger patients might experience more severe depression, for example. But it's that statistic I gave, 1 in 3, is pretty consistent across all kind of demographics. But in terms of which treatments might be more suitable for different people, that's something we need to understand more, because there won't be a kind of one-size-fits-all solution. For example, medication or talk therapies or other kinds of psychological support may work for some people, but not others. So a part of the ongoing research and what we need to establish is not just what interventions seem to work. The real question is, and who do they work for? How can we tailor our support to maximise the benefits of our treatments and our support?
Yeah, thank you again. We're getting a lot of questions coming in here, so we won't be able to answer all of them, but we will try. And Joe, I think you've said you'll answer any. We'll get answers back out to anyone who's asking questions. That the audience will hear the replies. We have one here asking how early in someone's kidney journey are we encouraging patients to access mental health services?
That's a really good question, and we don't quite know yet, but my sense is we should be doing this at the very early on. It's almost recognizing things like depression and anxiety. Once people approach, for example, dialysis, often they might have lived for several years really struggling with their mental health, which could also affect their physical health. So I think we should be screening and supporting patients really from the off.
Yeah, and I think again in the chat I can see lots of people saying they've had, someone saying it's never, capital letters, mental health has never been mentioned in the 15 years of living as a kidney patient, and these are quite stark comments. Several other people have said that too in the chat bar, and your statistic of 1 in 3, there's a mismatch there somewhere, isn't there? There's such a high prevalence, and yet for many people it's just not being aired. So I think the work you're doing to get this out in the open and be discussed by both the practitioners and clinicians and the patients has got to be good. And that takes us back to what Andrew said about, let's talk about it. We've got to keep talking. It becomes more normal for us to talk about it, and that will help us drive forward changes in practice. So I'm not sure if we've got time for any more questions. I think we might have time for just one more. And I wonder if I can ask how COVID-19 has impacted on your study, the study that we're funding. I think it's had a bit of a delay effect, but.
Yeah, it's obviously, had an impact upon not just the timeline of the study, but also the kind of questions we're asking, because one thing I probably should have said at the beginning, psychological distress it's normal. It's an entirely appropriate response to challenges, and that was naturally heightened in the pandemic, particularly in people living with kidney disease. So we had to certainly redesign some aspects and factor the kind of the COVID-related stress that a lot of people felt. So it has affected it, but we're back on track, and we look forward to hopefully having some results to present hopefully to you all soon.
That's great. So I think maybe I'm going to ask one more question because it's appeared in several places. So apart from age diversity, which we've been talking about, I've also got a question here saying, will ethnicity also be factored in? Because we know there is an increased prevalence in some populations of our community of CKD. And does that need to be factored into your understanding and your recommendation?
Yeah, I mean, that is such an important question. So as part of our work, we are looking at people from ethnic minority backgrounds' experience of mental health access and some of the particular barriers that they may face in terms of access and effective treatment. So we are looking at that. And, health inequality, as Sandra reflected early on, it's one thing we're very passionate about addressing. And mental health in itself is a health inequality in terms of its impact. So we're definitely factoring in the impact of depression across all patients, particularly people from ethnic minority backgrounds. Yeah.
Joe, thank you. We have reached the end of our time with you, but I'm sure there'll be other conversations to be had. And I know that we'll be able to take that out to supporters and feedback progress as you move through. It's a really exciting project. I'm delighted that you and the team are embarking on it, and I know that it's going to make a difference when you get it through to the stage of influencing the actual care management, which is what we're all aiming to see. So thank you very much, and thanks for your time joining us today to talk about it.
My pleasure, and thanks everyone. Thank you.
I'm now going to introduce our final speaker, Bushra Riaz, who's one of our colleagues based in Glasgow. And I think I've been told you have a bit of a technical hiccup, but so if we lose you, we've got cover from Alison and other of our colleagues. So Bushra is our policy officer based in Glasgow and working across the organisation, and has been involved in our mental health campaign for kidney disease around World Kidney Day. Bushra, I'm just going to run through a few questions with you, if that's okay with you. Can you hear us all right?
Yes, yes. Can you hear me okay?
We can hear you fine. We've heard from Andrew and from Joe about the importance of mental health for kidney patients, and we can see it in the chat bar too, and the impact it can have. Can you tell us a little bit about what the policy team has been doing to shine a spotlight on mental health issues, particularly today on World Kidney Day?
Yes, Sandra. So yeah, as like you said, we've just heard from Joe and Andrew from a personal perspective and from a clinician perspective as well. You know, we know the stats that approximately 3 million people in the UK have kidney disease today, and every day 20 people with kidney failure are going to develop kidney failure. Approximately 30,000 people are on dialysis. I mean, it's a huge number, and for these people, you know, when we think about people without any chronic illness, as Andrew said and Joe said, it's a huge impact being on their mental health, just with lockdown, the pandemic, isolation. It's been very difficult. So for those with chronic kidney disease, it's been a very, very difficult time over the past couple of years. So hence, kidney mental health is one of the top priorities for patients. So as of this, we needed to raise awareness. So what we did was we drafted a survey with input from patients and clinicians in January, and we then it was promoted through, you know, social media, through the charity Kidney Voices, through newsletters, and we had responses from over 1,000 kidney patients. I mean, it's phenomenal the number that people had responded back to us. Just to go through a couple of the stats that we that had come back from the survey that we've done, 67% of the kidney patients had experienced some form of depression, and 68% had not been offered any mental support at all. And out of that, even out of the people that had responded back, 27% had considered self-harm or suicide as a result of their kidney disease. I mean, very, very stark stats. And really upsetting to hear as well. So what we did was then we set up a patient advisory group, and they helped us build the materials and ideas together. And again, thank you to everyone that joined that group. And then we launched our campaigns in Edinburgh, Scotland and Wales. We agreed not to launch in Northern Ireland just due to the political situation at the moment. So our aim was to target the MPs in Westminster and MSPs in the devolved parliaments, Scottish Parliament and the SNED in Wales. As the mental health policy it's because they're devolved countries, it's the responsibility lies in Edinburgh and Cardiff. So by doing this, we worked with clinicians and psychologists to develop these policy asks for the 3 different nations, and then we produced a toolkit with advice for the patients and supporters, and that was to help them to arrange meetings and raise awareness on the mental health, and that was just supporting guidance throughout.
And what level of engagement have you had from, well, certainly from patients? I know you've had lots of input, which is fantastic. Have you been able to get that cut through to get responses from politicians? Are they hearing what we're saying here?
Yeah, I mean, from our policy ask, because obviously this is one of the first times that we've ever worked on policy ask for mental health, and you know, through the support from the patients and the supporters, we've had over, I think it was approximately 100 people that took action, and that was like emails that were sent out to MPs, MSPs to arrange meetings, you know, write letters to them. And they've been doing that over the past couple of days and today as well with World Kidney Day. And I'm sure everyone's seen the Twitter feeds and social media. It's phenomenal. I think we're rated, I think last time I checked, at what was it, number 6 or something? And hopefully we'll get to the top 3 by the end of today.
I think we were at number 4 when I last heard, so I'm not sure. Yeah.
Yeah. So we know, I mean, you know, the lack of knowledge within politicians on chronic kidney disease is very, very low. One of the politicians I know that we met last week, his daughter sadly passed away and she became an organ donor, so she donated her kidney. So I think unless you've been affected by it personally, it's something that's, you know, it's then that they will take it forward to raise awareness on that. So, like I said, you know, we've been reading the MPs and MSPs have been tweeting all day today. You know, they've been writing letters to myself and my colleagues, and some of the MSPs and MPs have actually tabled motions as well about recognition of World Kidney Day in Parliament, and you know, just supporting our campaign. And it's great to be able to build that relationship with the MPs and MSPs. And also just talking about kidney disease and dialysis and mental health on patients.
That's great, and I know there's been a lot of conversations today and telephone calls into MPs, and of course we'll see some of the outcomes of that emerge over the next week or two as they hopefully move to raise questions in Parliament or meet again with perhaps constituents. And if it's not too late, you know, although we were making a push for today, this isn't the only day. We want people to be talking to their Member of Parliament. That can really count for individual patients to be telling their story to someone who's got an influence in Parliament. So I would encourage everyone, if you haven't yet looked at the draft letter we're suggesting we send to MPs, it's not too late to do that. And it's really about making a bit of noise and demanding something greater than perhaps we've had before in the terms of really focusing on mental health. As we've heard from Joe, there's quite a lot of work to do to really get it on the agenda. So are there plans for the next stages of what we do around policy work directly in relation to mental health then?
Yeah, I mean, from the survey and the work that we've been doing over the past couple of months, I mean, there's a lot of work to be done, as we know. I mean, it's driven by the patients and it is one of the top priorities and focuses for us. What we will be hoping to do is working with different stakeholders and building on those relationships with the MPs and MSPs to make sure that mental health is an important factor for those with chronic kidney disease. And by doing that, we're hoping to develop our policy in this area to come with a more stronger campaign on policy on mental health. So, you know, as we always do, we'll continue raising the awareness on kidney disease and mental health and building on that in the political support. Even the Westminster government, they're due to publish a mental health strategy over the next year, and they will be launching consultation shortly. So we will be responding to that consultation, and hence, you know, that will make the case stronger for better mental health support for the kidney patients. So yes, there's a lot to be done, and hopefully, you know, over the next few months, we can work together with different organisations, stakeholders to build that support.
It's fantastic. It's really reassuring to hear that. I mean, I think in the last time we've really begun to build a bit of momentum behind this strategic priority for the charity. There's quite a few people mentioning in the chat bar asking for the letter. I think Caroline's put it in there, but if people can't access it from there or want to email us or call in to support or care later, please do that, and we'll make sure we equip you to speak to whoever your Parliament, whichever Parliament's responsible for your healthcare. We're very keen to just keep the pressure on, I think, really in the right way, so that we can really make a difference. I think Bushra and I have been on a conversation earlier today with preparing for a meeting with Public Health Scotland And I think the work that you and the policy team are doing is enabling us to start holding some of these meetings. There's a meeting next week. I can see Jelina's on the chat, and it might be good to get some quotes from Jelina and any of our other fellow Scottish participants in today's call to give us some backup that we can take to the public health teams. We've got an opportunity to speak directly with the Chief Officer of Public Health Scotland, and I think they're the people again that influence change, that will respond to some of the work that Joe and the team are going to be producing, and hopefully that can transform it through into an actual change in practice, which is what our policy team is aiming to achieve. Anything else that you wanted to add, Bushra? Your work's really important in Scotland. You've previously been working on organ donation in Scotland for many years, and this move to policy is working very effectively. It's lovely to have your voice in the right places up in Scotland, and working with Alison down here in England and in Wales. Any final thoughts you might want to share with us before you leave?
No, just to say thank you to all the patients and supporters and our colleagues, because we wouldn't be here today if it wasn't for the patient support, and their input and their patient perspective is always highly important, and that's what gives us the ambition and drive to make sure that we can hopefully one day cure kidney disease.
So thank you, Bushra, and I think it's really my chance now just to kind of sum up what I think has been a fantastic hour. You know, I wish we had more time with each of our speakers, because I think all of you have brought from your own personal perspective something quite different, and I know I could certainly have listened to each of you for longer, and I certainly had more questions I would have asked you, and there were more appearing in the chat bar as we went through. So thank you for that snapshot of time to give us the current perspective, increase our understanding of the impact of living with kidney disease, and particularly the impact on mental health and well-being. And I suppose it's an opportunity for me to say this is a really important part of what the charity is doing. Our efforts, you know, will continue in the labs to try to stop kidney disease happening, but we know that will take time, and in the meantime we want to transform treatments, and that improves the quality of life and the prospects for living well, until we can get to that end goal of ending kidney disease full stop. It's been a really difficult couple of years for both the charity and certainly for individual patients, but I think we've learned and grown as part of that, and there's some really exciting work beginning to happen in the years ahead. I kind of feel I want to say something about the current position around Ukraine, just because I think it's in all of our minds at the moment, that as we're emerging from COVID and an extraordinarily difficult period of time, we're entering a new one, and it really to reflect on the people who are living with kidney disease in that country. And we are aware of international efforts to try to ensure that anyone who's on dialysis or trying to have dialysis treatment delivered to them in extraordinary difficult circumstances, that's being supported by a variety of organisations. And I hope that you don't mind me raising that here at this time. I think it's just really important that we reflect on the difficulties that our fellow kidney patients in a country that's under huge pressure at the moment is in our thoughts. I know that there are some people who've been able to get out and get across into Poland, and dialysis is being delivered there, and I just hope that the majority of people were able to do that earlier rather than later. There are some people putting out some international approaches to support that, and I think you'll be able to see that again across some of the Twitter and Facebook pages. So I've got nothing else to say other than a huge thank you to our three speakers. Thank you to the team, Caroline and Gemma and Sarah, who've set up this session. thank you to all of you for joining us today. And I hope that as we move forward into the year ahead, we'll see you again. And we'll hear from you again, and we'll certainly be responding to any questions that we have there. And I hope that in the year ahead, some of you might have an additional look at the Andy Cole Fund, what we're trying to achieve there, and get behind the support that Andrew's giving us to really put kidney disease on the front pages, on the Twitter rankings up there at number 4 or wherever it is today, because talking about it, raising awareness will make people respond, and we'll all be able to move forward at an even faster pace in our research. So thank you very much to everyone. Thank you to everyone who's joined us, everyone who's been a part of making today happen, and to all of our speakers.
Thank you.